Hello everyone, good morning everybody. I am Sanya, your host from Beautiful Spotless Skin Team. I am sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans' right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also as blemishes, black heads, white heads, pimple, or cysts. It is most common during puberty and adolescence. According to recent data, almost 80% of people in the age group of 11 to 30 years have acne breakout at least once. Although acne most commonly does not have any serious health concern, but it is distressing for the sufferer. The faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is essential. For today, we have with us Dr. Priyanka Tarale, a consultant dermatologist from Delhi, live with us to educate us more on acne management. Dr. Priyanka has more than a decade of experience. She is a medical director and consultant dermatologist at Skin Price Clinic based at Delhi. She did her MBBS from Nagpur and post-graduation in DDVL from NTR University of Health Sciences, Vijayawada. With her vast experience and specialty in today's topic, Dr. Priyanka will enlighten us on management of acne. Doctor, first of all, a very warm welcome to you.
Thank you so much, Sanya, for such a warm reception and welcome.
Thank you. Thank you so much. And doctor, as we're going to talk about acne management, यानी कि हम acne के बारे में बात करने वाले हैं और हमने कई बार देखा है कि usually लोग समझ नहीं पाते हैं कि the acne जो उनको हो रहा है is it like pimple, simple है और धीरे धीरे वो बढ़ता जाता है. So अगर हम सबसे पहले बात करें, so what is basically acne and how a person can see that this is basically is harming his face and उसको डिस्ट्रेस भी कर रहा है. कई बार स्ट्रेसफुल कंडीशन भी हो जाती है. So what is basically acne and if we talk about its causes also, so what are the causes of acne as well?
Okay, so first of all, see, पहले acne की जब भी बात होती तो we used to consider that teenage problem है. But right now, with the changing scenario and changing habits and our day-to-day stress level, acne is now not limited to teenage problem. It's more of an adult problem as well. And in fact, we are getting females who are getting acne post-menopause also. So right now, acne is more like, you can say, lifestyle disorder. Okay, so acne में होता क्या है? Acne में basically जो आपके oil glands होते हैं, वो उसका disorder है. Oil glands का एक ही काम है, they are present over your face, arms, chest and back. And whenever we hit puberty and hormonal issues हमारे changes आने लगते हैं body में, तब oil gland active होते हैं and they start producing an oily substance which is known as sebum. Now, acne में basically ये sebum का overproduction होता है या फिर उसका जो outlet medium है, the pores which are there, जिससे वो बाहर निकलता है, उसमें बहुत ज्यादा आपके cells बन रहे हैं, वहां पे बहुत ज्यादा आपका dirt या फिर हम कई बार oily चीजें लगा लेते हैं तो उसका deposition हो रहा है, तो वो जो sebum produce हुआ है वो बाहर नहीं निकलता है. So that would be a first step of acne. Now later on what will happen, the bacteria which can cause acne is already present in our skin, वो उसको एक fertile ground मिल जाता है बढ़ने के लिए, नंबर मल्टीप्लाई करने के लिए, and because of that then we get the red color का proper pimple. And then comes our pustule stage, जिसमें basically हमारी body अपना defense mechanism play करती है and उसको बैक्टीरिया को खत्म करने लग जाती है. Then हमारी severity धीरे acne की ऐसे बढ़ने लग जाती है. So initially was a blackhead and whitehead blockage, then came the proper pimple जिसको हम papule बोलते हैं medical term में, and then came the pustule जिसमें हमारी body defense mechanism से उसको मार रही है. उसके बाद की भी ग्रेड्स आते हैं हमारे जिसमें और बड़ा हो जाता है वो, जिसको नोड्यूल या सिस्ट बोलते हैं. एंड मेनी टाइम्स जब ये एक्ने आपका सबसाइड होता है, दैट विल लीव बिहाइंड अ पिगमेंटेशन या फिर स्कार्स. नाउ दिस इज हाउ एक्ने इज हैपनिंग जनरली. व्हाट कैन लीड टू एक्ने? सो इसमें आपके हार्मोनल चेंजेस, आपका मीठा खाना, इफ यू हैव लॉट ऑफ डेयरी इनटेक दैट इज डायरेक्टली रिलेटेड टू एक्ने. ओके, इम्प्रॉपर लाइफस्टाइल, लेट स्लीपिंग पैटर्न. अगर आपका स्लीपिंग पैटर्न भी ठीक नहीं है तो बहुत सारे स्ट्रेस हार्मोन रिलीज होते हैं जिसके बाय प्रोडक्ट से अगेन ऑयल प्रोडक्शन होता है एंड देन दैट लीड्स टू एक्ने. बहुत सारा ऑयली चीजें फेस पे लगाना या बहुत मेकअप करना फ्रिक्वेंटली, बहुत बार फेस टच करते रहने से भी होता है, कई बार रात भर हम सर पे तेल लगा के रख देते हैं, कोकोनट ऑयल पर्टिकुलरली, दैट कैन ऑल्सो लीड टू एक्ने। सो एक्ने के लिए जो अगर आप मूल कारण अगर बोलते हैं, द बेसिक रीजंस वुड बी मोर ऑफ डाइट, लाइफस्टाइल, improper handling of your skin, and milk intake and sugar intake as well.
Okay, so यहाँ आपने जैसे बताया there are many causes, sugar intake, dairy products, and sometimes people do a lot of makeup and they don't clean it.
Yes.
That's why also acne can occur. So there are different causes of acne. Doctor, when we are talking about acne, and as you already discussed that पहले वो black heads होते हैं and then they cyst बन जाते हैं कभी कभी. So what people do is they just like pop it up, that
Yes.
pimple आया है and it is like there, so just pop it up तो ये चला जाएगा. So is it like safe to pop it up? Because I've seen many young boys as well and girls as well, they see a pimple and they just pop it up, उसमें से blood come out and they are like okay, now this pimple will be like gone forever.
So उसमें बेसिकली होता क्या है, इफ यू ट्राइंग टू फिडल विद इट या हम उसको मैनिपुलेट करके निकालने की कोशिश कर रहे हैं, टू थिंग्स कैन हैपन फ्रॉम दैट पार्ट. एक तो आपका जो वो फूट के बाहर निकलेगा, वट एवर इज कमिंग आउट, आपकी वो अनकंट्रोल्ड हीलिंग होगी तो खड्डे ज्यादा डीपर हो सकते हैं, अनकंट्रोल्ड हीलिंग की वजह से वो ज्यादा पिगमेंटेड भी हो सकता है. सेकेंड ऑफ ऑल, जब भी हम उसको थोड़ा सा भी फिडल करके मैनिपुलेट कर रहे हैं तो चांसेस ये भी होता है कि वो इन्फेक्शन बाजू में भी स्प्रेड हो जाए. सो इंस्टेड ऑफ कि वो रेगुलरली अपने नॉर्मल तरीके से बॉडी अगर हील करने की कोशिश कर रही है, वो हो सकता है ज्यादा टाइम भी लगा हीलिंग में, और इट कैन स्प्रेड टू द सराउंडिंग ऑयल ग्लैंड्स एज वेल. सो डेफिनेटली फिडलिंग इज अ स्ट्रिक्ट नो. Like we always educate, I try to always educate my patients that whatever is coming, we can handle it, but don't try to fiddle it.
Right. So don't fiddle it and go to a dermatologist instead if you are having such acne or pimples. Doctor, when we are talking about the acne, so are there any grades of acne? Like
Yes.
These are somewhat like the grades. So what are basically the grades of acne if we talk about?
सो हमने जो पहले मैंने बात की थी आपसे कि पहला ग्रेड हमारा रहता है जब आपके ऑयल ग्लैंड की ओपनिंग बंद हो जाती है, दैट इज फर्स्ट ग्रेड, जिसमें हम देखते हैं व्हाइट हेड एंड ब्लैक हेड. सो मेडिकल टर्म में इट इज नोन एज कॉमेडॉन. सो ओपन कॉमेडॉन वुड बी योर ब्लैक हेड एंड द क्लोज कॉमेडॉन वुड बी योर व्हाइट हेड. वो ब्लैक दिखने का कारण ये है कि एयर से कॉन्टैक्ट आके आपका वो थोड़ा सा रंग बन जाता है, वहां पे रंग दिखता है, सो दैट इज रिफ्लेक्टेड एज ब्लैक हेड. देन कम्स द सेकेंड स्टेप विच इज नोन एज पैप्युलर स्टेज, सेकेंड ग्रेड बेसिकली, जिसमें पैप्यूल्स ज्यादा होते हैं कंपेयर टू द ब्लैक हेड्स एंड व्हाइट हेड्स. पैप्यूल स्टेज इज बेसिकली व्हेन वी ऑब्जर्व दैट यस पिंपल आ गया है, दैट रेड कलर lesion which is seen over the face, so that is your papules. Then comes the third stage, the grade 3, in which we normally see pustules, when the body's defense mechanism comes into play and all the pus is being formed. वो जो भी बैक्टीरिया है, so the bacteria which is causing acne is known as Cutibacterium acne. उसको पहले प्रोपिनियोबैक्टीरियम एक्ने बोलते थे, अभी नाम चेंज करके क्यूटीबैक्टीरियम एक्ने है. सो जब भी क्यूटीबैक्टीरियम एक्ने इज देयर, सो आवर बॉडीज डिफेंस मैकेनिज्म विल कम एंड वो उसको खत्म करने की कोशिश करता है, तो एवरीथिंग गेट्स टर्न्ड इनटू अ व्हाइट पस पॉइंट. दैट इज योर पुस्टुलर थर्ड स्टेज. एंड देन अगर वो तब भी कंट्रोल नहीं हो रहा है और बाजू का भी ऑयल ग्लैंड अगर इन्फेक्ट हो रहा है, तो मिलके एक थोड़ा सा सॉलिड हार्ड सा एक लीजन बना देता है. अगर वो सॉफ्ट है तो हम उसको बोलते हैं सिस्टिक एक्ने, और अगर वो हार्ड है तो हम उसे बोलते हैं नोडुलर एक्ने. So grade 4 is nodular and cystic acne.
Okay, so there are 4 types of grade of acne, and doctor, sometimes the acne is also painful. It hurts when you have it on your face. So that is which type, which grade of acne?
It would be more of 2 and above. जब भी आपका papule से pustule की तरफ जा रहा है, severity increase हो रही है, that time it becomes hurtful.
Okay, so that would be 2 or above. So knowing your grade as well is important, that this is the grade 1 or 2 or 3 or 4. Doctor, we have discussed about the grades, like the different types of acne. What is the I can say the management or the early management of acne is there? How we can prevent it from causing, and why it is important that if you see acne, you should go to a dermatologist instead of treating it by yourself or popping it. So what is the early management of acne is at most important?
Sanya, you have actually asked a very important question. Now, why we stress that whenever you have acne, आपको dermatologist के पास जाना चाहिए. उसकी reason ये है, if we keep on waiting, basically, अगर पहले 10 हैं आपके, आप wait करते करते उसको 50 तक लेके जा रहे हो, या उससे ज़्यादा number, तो उतने ही उसकी scarring और pigmentation के issues हैं. The earlier you visit a dermatologist, the earlier you can handle the situation. And उसके फिर डाउन टाइम और जो होते हैं ना, उसके सिक्वेले जो होते हैं अपने मार्क्स के हो गए या स्कार्स के हो गए, वो उतने ही कम नंबर में मिलेंगे. एंड ऑलवेज जब भी हमारी स्किन में स्कारिंग होती है, वो कभी भी नॉर्मल नहीं हो सकती स्किन. देयर इज ऑलवेज सम चेंजेस व्हिच हैज हैपेंड इंटरनली. सो जितने जल्दी आप जितने कम ग्रेड्स पे जाके अपने डर्मेटोलॉजिस्ट को विजिट करके दिखा लेंगे, उतना बेटर है. Coming to the management aspect, now as a dermatologist, we have to rule out all the factors which can cause acne, which can aggravate it. Be it your lifestyle, आपका खाने का इंटेक कैसा है, आपका जो लाइफस्टाइल इंटेक है, आप कैसे सो रहे हैं, कब उठ रहे हैं, आपका डाइटरी में क्या क्या आप दिन में ले रहे हैं. उसके अलावा हाउ मच मेकअप यू अप्लाई, what is your routine, are you fully exposed to the sunlight or throughout the day you're outside or you're indoors, how much is your touching your face habit. So those peculiar things are there which always aggravate and can lead to acneiform eruptions. During COVID, we had more of the mask usage. So mask usage se bhi mask acne bade the. That was because of the occlusion, heat, and humidity which was present over the face. So kisi ko kabhi bhi acne nahi raha, lekin with the mask also it came in between. So there were proper guidelines which were being made to understand people when they were using mask. So yes, history taking is very important for a dermat to understand what is leading to it. And many times nowadays the most common reason is the hormonal imbalance which females are facing. So in that case, the strict no from a dermat side would be no for a dairy intake, like you have to stop milk completely. Milk and sugar is something you have to stop completely. You have to increase your exercise routine a little bit, at least go for walks, and reduce your weight, have controlled diet, increase your water intake, have the seasonal fruits. So all these peculiar habits you have to inculcate in your daily day-to-day routine. Apart from that, then we start with the basic medication. Kitni grade hai, then we can start on something, a tablet which is known as isotretinoin, which is always under a dermatologist guidance only given. We have to get some baseline tests done for that to start the medication, and then routinely we keep on monitoring how the body is able to take up that tablet. This tablet is particularly a strict no for females who are planning for pregnancy, but it's a wonderful drug, works very well for acne. Then there are antibiotics which can be given along with this isotretinoin to help in calming the acne. कोई अगर बहुत grade है, बहुत severe आ रहा है acne, उसको calm करने में help करता है. Then we have topical management. Now topical management we have AHA, PHAs, अभी influencer के वजह से सबको पता है. But being said that, yes, we have to incorporate certain AHA, BHA based products. Being said that, हमें अपनी स्किन बैरियर को खराब भी नहीं करना है, जो यहाँ पे अभी सबसे बड़ा इश्यू है. सो काफी लोगों में देखा है कि वो सेल्फ मेडिकेट कर रहे हैं फॉर एक्ने एंड दे आर टर्निंग अप विद रेड फेसेस और इरिटेटेड फेसेस और अ फ्लेकी फेस जो हमेशा रेड रहता है, एंड दे कॉन्स्टेंटली दे आर इचिंग और दे समथिंग दे आर अप्लाइंग ओवर द फेस टू काम इट, एंड दैट इज नॉट हेल्पिंग. So you should have a very good skin barrier for the skin to heal as well, and that is where the dermatologist comes into play. What to apply, how much to apply, and what frequency to apply, that is also very important.
Right, absolutely. And as you said, that consulting a dermatologist is must, because sometimes we self-medicate, and if we see that this particular thing or this particular medicine is working out, and for sometimes we are like the acne is gone, but as the doctor said that it can lead to many problems. Doctor, as you said, a healthy lifestyle is very important for everybody, to physical exercise or eating healthy, but sometimes people actually ignore it, and they feel कि थोड़ा सा खा लेते हैं, थोड़ा सा sugar खा लेते हैं. So how much water, as you said that water intake is also must. So what is a healthy lifestyle one should, if somebody have acne, what is a healthy lifestyle or dietary precaution one should necessarily take if they have acne on their face or in their back as well?
So basically there are 3 to 4 things which I tell my patients, each and every patient of my acne. As I told repeatedly, I'm actually stressing on this point. You have to stop milk, you have to stop sugars completely. You have to stop chocolates as well. So there's no buy, thing ki ye to chalega, this is safe. No, nothing related to sugar should be taken. You can start with something like omega fatty acids are very good in acne. So you can start with your walnuts and almonds. That's fine. Overnight soak karke morning mein you can incorporate that in your daily routine. You can incorporate green tea. It is very good antioxidant. Vitamin C based jo aapke rehte hain, और seasonal fruits bhi aa rahe hain, citrusy, that is very good for acne as well. Water intake at least 8 to 12 glasses. Now that is something my patients feel that how to take it. So I tell them, let's make it very simple for you. As soon as you get up, within 15 minutes, drink 2 glasses of warm water. And when you're going in bed, take 2 glasses of warm water. So your 4 glasses are sorted in the day. Now rest 4 to 6 glasses, you can anyhow divide it throughout the day and have it. Right. So that is something very important. And many times dehydration also leads to a lot of, flaking and overproduction of oil and open pores as well. So you need to correct that factor as well. And then apart from that, you can have your cheat day, but limit it. Let it be a cheat day only and once in a while. Not every day is supposed to be a cheat day. Okay. And apart from that, so milk, I have said no. Milk, there is another reason why I specifically stress on that point is the cows are actually given a lot of hormones, and that hormones to secrete more milk basically. And that same hormone is being secreted in the milk, which we take. Now that leads to a lot of hormonal imbalance in the one's body as well. And that is when we get a lot of, the acne is there, the hirsutism, the hairs are coming over the face, or the PCOD issues are there. So one should limit their dairy intake. Then apart from that, if the weight loss is there, if someone is obese, they should promote, healthy walking, lifestyle changes to decrease weight. Once the weight decreases there, so there is a hormone which is insulin-like growth factors. In acne, if that level is high, that can lead to acne. That can lead to other hormonal imbalances as well. So if you reduce weight, that helps in calming it down. Then apart from that, if you are applying makeup and all, you should restrict that as well. There has to be a proper non-comedogenic products which you need to start using. Heavy based makeups and foundations should be used as least as possible. And in day to day, instead of all those things, you can shift to tinted sunscreens. Those would be suitable ones, a good alternative basically. And apart from that, I have seen a lot of times many people touching their face repeatedly. So that habit has to be curbed down as well.
Okay, so do not touch your face again and again, and avoid milk if you are having acne, because as doctor said that these are all the things. Physical activity can definitely help you in managing your acne. Doctor, when we are talking about acne, like this is a myth, or I really wanted to know that acne can only happen in the young age, or it can happen with the old age as well.
Right now, it can happen at any age, be it a male or female. Everyone is going through certain acne is not something which will happen in your teenage, and it cannot happen again later on. It is something which can happen, or just could be a change in the lifestyle, a change in the weather, or change in your routine. If you are having the kind of your job pattern has changed and you have to be awake for a longer time at night, at that time also the stress hormones are released and acne activity increases, the oil activity increases. So it is not something which is like teenage mein 23 22 tak raha bas khatam ho gaya. It's not like that anymore. Now we have acne which is actually starting from 25 age and above. Middle age also, people who are trying to conceive, they are on hormonal supplements, they are also getting acne. So it is no more a teenage problem, it's a more of a lifestyle issue, and it can be seen in chronic patients as well.
Okay, so now it has become a lifestyle issue. Earlier, it was like, due to hormonal changes in adolescence, it occurs, but now it has become a change that everyone, at any point of age, can get acne, right, doctor?
Yes.
So, doctor, when we are talking about acne, its management, as we already discussed, that it can happen, to any age and any people. So how to basically, prevent, sometimes people have acne breakouts also. So how we can prevent acne breakouts?
So acne breakouts, they would be something which has, preceded the acne breakouts. Either it could be the hormonal changes. For females, particularly their menstrual history is very important. Whether there has been certain changes which has happened, weight gain हुआ था, या कहीं वो छुट्टियों में गए थे तो बहुत मीठा खाने में हो गया था, या फिर कोई wedding आया था and then there were some occasions and they were repeatedly applying makeup, or there was some borderline, it's not PCOD, it's the PCOS, the syndrome, which is like the borderline, it can go into it. So if someone can, make changes in their lifestyle, it can get corrected as well. So all this can lead to that. We need to find out the reason why it has happened and then try to control it. Certain times देखा गया है कि medication से भी बढ़ते हैं acne. Certain medications for like anticonvulsants are there. Sometimes steroids अगर किसी को कोई inflammatory issue है body में जिसके लिए दिया जा रहा है, उसके बाद भी acneiform eruptions आ सकते हैं. So the underlying cause has to be known and then it can be corrected. The acneiform eruptions can be maintained, can be corrected with your oral antibiotics, isotretinoin, as well as the topical agents. Anything which is glycolic, salicylic, benzoyl peroxide, adapalene in combination or single agents with azelaic acid, one of my favorite agents, all those things do help in controlling that acneiform eruptions.
Right. So, but you have to consult your dermatologist before
Yes.
Trying, to treat themselves. Doctor, now we have some live viewers question as well. So our viewers watching this live session. There is one viewer, John, asking, Doctor, I have been struggling with acne for a while now, and it's really affecting my confidence. Can you please provide some information on acne and how to manage it?
Okay. So John, first of all, thank you for putting up this question. I understand, like we all dermatologists, we see a lot of patients who are coming up with acne, and it does, matter because it's your face at the end of the day. And it does affect your confidence and your basically presentation all over. So acne management, you can keep it very simple. For a male, I know that it's not possible everyone to have 10 steps, routine, skincare routine, but keep it very general and basic. So I'm not sure what kind of acne grade you have, but I'll just give you a brief how you can manage it. So morning, you can have a good, you can do your face wash with a normal cleansing water. It should not cleansing, basically face wash. It should not dry out or strip off your skin. Just maintain your skin barrier. Then you can apply something which would control the oil formation. It can be something like a niacinamide based or salicylic acid based, 1 or 2%, not more than that. And follow it up with a good moisturizer. Now, acne prone skin do require a hydration moisturization. It's not like that oil is being formed, to हमें जरूरत नहीं है. A thin layer has to be applied so that the barrier is always in a good supple way. And you can layer it up with a sunscreen. At the end of the day, now again, you can repeat with your face wash. You can add on maybe a prescribed medication if you can visit your dermatologist nearby. That should have something like, maybe if the grades is higher than benzoyl peroxide or adapalene, or the lower dosages, like the lower grades also, you can start with low dose of adapalene, the lower strength of adapalene, sorry, follow it up with a moisturizer. Now, my treatment protocol is a little different, but that I can only judge, and on examination only I'll be able to say. But if you follow up this basic routine, face wash, something to decrease oil production, moisturizer, sunscreen in the daytime, and nighttime face wash, again something to work on acne, active acne, and then follow it up with moisturizer. That would be the good basic routine.
Okay, and I hope, John, you will definitely take care of your skin and consult your nearby dermatologist. As a doctor, it is always like the skin care routine is always for the girls because they are more like quite what can I say, sensitive to the skin. But I think boys should also take care of their skin as well because it is very important that boys should also take care. So I hope, John, you take care of your skin as well and consult your dermatologist. Doctor, there is next viewer question asking, should I modify my diet in any way to help reduce acne breakouts? This question is by Faria.
Okay, thank you, Faria, for posting up this question. Now, Faria, so it would depend what kind of diet you already have. As I have stressed again and again, 4 to 5 things you need to stop, and other things what you can incorporate is basically stop with the milk, dairy, sugar, increase your water intake, have almonds and walnuts, omega fatty acids do help. One can also incorporate flax seeds in their daily diet, 1 or 2 teaspoons daily. And I have seen in certain individuals, black raisins also help, those who have premenstrual flares. So overnight soaked 4 to 5 black raisins, if you have it early in the empty stomach in the morning, that also helps up to a certain extent. And regular diet with the best diet is actually the Indian diet. Have the roti, sabji, dal, chawal, ghar ka, that's all fine. don't indulge too much into sweets with the other desserts and all. So you can start with your roughage with the salads first, then go into your protein intake first, and then you can do your carb intake. And last would be the kind of fat intake. So you start with your salads, have your dals and other protein intake, and then you can have the carbohydrate part. So basically what it does, when you start taking your meal, the fiber and the salads will help in calming the, it will produce bulk. So your satiety center will start working. It will not feel hungry more. Then your protein intake should be the next thing. That also helps in calming the satiety center. Like it takes certain time for the brain to accept that पेट भर रहा है. So if we start with something like heavy fatty foods initially, so it's definitely going to land up with weight increase and other things. So again, the acne will always be there if you don't reduce weight. So if you want to daily intake में fiber पहले शुरू करो, that will help more. And of course, the water intake should be at least 8 to 12 glasses. And have a cheat day. But as I mentioned, not every day is a cheat day. It should be once in a while, like once in 15 days or something, or 20 days. That would be good enough. And if you are having like consecutively, if you are attending any functions or something, then do make sure that you are, somehow balancing those diets, because you won't get the kind of diet which you follow at home. So try to balance it out somehow.
Right. So as the doctor said that make sure you have a cheat day, but not daily. Avoid taking sugar, avoid taking all the diet which doctor already mentioned, the sugar intake and the dairy products. Doctor, when we are talking about acne, so like different skin types have different types of acne. Is it like that? And the treatments for different skin should be different, and oily skin or sensitive skin or dry skin. So how is that identified that if I particularly have this kind of skin and the acne should be treated as well? Are there any different types of treatment for different types of skin type?
So basically, what happens, we see how much the oil activity is over the face, whether they'll be able to tolerate the, the salicylic acids and the benzoyl peroxides. If someone is having a very dry type of, skin, certain people have that red flaky skin type, which is more of the drier type, and still they'll have acne. So that is something, acne on dry skin. Now, those kind of individuals need to be very particularly, because if they start incorporating a lot of AHA and BHAs on their daily routine, they'll have more redness and flakier skin. And the acne will also keep on continuous coming. So in those cases, the basic routine which has to be followed for each and every skin type would be a face wash, something to control the oiliness. A moisturizer is a must. For a oily skin, I would go with something like a gel-based one. For a drier skin, I would go with the creamier little formulations. But mind it, everything has to be non-comedogenic. That means it's not clogging the pore. And then similarly comes with the sunscreen. If someone is having an oily type of face, more oil production is there, then the gel or the something like a water-based one, which is dry touch one, would be better ones. If someone is having a dry skin type, then with the creamier or the fluidy formulation would be way better. So it will suit their skin more. The acceptance and the the compatibility of applying it daily would be more. So depending on the skin type, which reason the person is staying, which season is going on. Right now, we are all having monsoons on and off. So it's more of a humid weather. So in humid weather, a creamy formulation is not acceptable. People don't like it to be, sticky on their face. So in this weather, the gel type formulations, they are way preferable.
Okay, so as the doctor said, there are different treatments for different types of skin, but for that you need to go to your dermatologist and consult that, because as doctor already mentioned that now monsoon is there in India, so humid climate, and that can also affect your skin. Doctor, there is another viewer question, Shania, asking, when should I consider seeking medical treatment for my acne?
If Shania, thank you for putting up this question first. But right now, what I would suggest, if it is making you bothersome, if it has started appearing, it's always better to go as soon as possible. Like, why you want to develop a khadda on your face and try to mend it later on? Just prevent the khadda from coming only. See, all the scars can come up at any particular point during the healing stages. So lesser the number of active acne, the lesser the number of scars and its sequelae over the face. So if you have the earlier control of your situation, you are going to have less problems later on to correct. So there's no hard and fast rule, but even if you are not having any acne, just probably, few 1 or 2 breakouts just before menses, it's always better go visit your dermatologist. They can help you out at least with your, normal day-to-day skincare routine, how you should follow and what things you're applying wrongly.
Yes, and as precaution is better than cure. So be, precautionate, be consult your dermatologist and take care of your skin. Doctor, there is another weird question that should I modify my skincare routine to address acne while also considering signs of aging?
So, the good point about acne, like the medication which we normally give, there would be retinols into it. Now, even if you incorporate something, now the cosmeceutical grade of retinol is not that stronger compared to the pharmaceutical grades. So if a doctor is prescribing a retinol, it's going to be more efficacious and will give you faster result compared to the brands which are available in the cosmetic brands, under the cosmetic brands. Now, being said that, if someone has acne and wants to start with the anti-aging routine, a retinol would be the good product to start with. It works on your collagen formation, it stimulates your skin, it works on your skin cell turnover. Basically, आपका blockages वगैरह भी clear होंगे, acne scars भी थोड़े से improve होंगे, थोड़े fine lines, wrinkles हैं तो वो भी improve हो सकते हैं. So that would be the golden product you can start with. Now, the only thing is, don't go to a chemist and just buy the retinols like that. Go to a dermatologist so that they can guide you on which days and how much you should start applying. उसको धीरे धीरे increase करना होता है. If you apply like that only with a pharmaceutical grade retinol, you'll land up with red face. And that is another issue we dermatologists are facing nowadays a lot. People are just going and buying it on themselves and coming up with a tomato red face.
राइट एंड आई थिंक डॉक्टर कई बार ऐसा होता है कि जब हमारे फ्रेंड्स हमें सजेस्ट करते हैं कि ये पर्टिकुलर चीज अगर आप पिंपल पे लगाएंगे तो एक रात में आपका पिंपल गायब हो जाएगा, तो जाके मेडिकल शॉप से ये पर्टिकुलर ट्यूब आप लेके आइए. एंड वी डू इट बिकॉज इफ समथिंग इज हैपनिंग टू समबडी और उससे उसको फर्क पड़ रहा है, सही हो गया है, सो वी डेफिनेटली गो दैट. चलिए ट्राई करते हैं. एंड देन एज डॉक्टर सेड दैट डोंट गो टू just any medical shop, ask for something, because all the skin types are different, as we have already discussed, and you should definitely consult your dermatologist before medicating by yourself. Doctor, when we are talking about sunscreen, as you already told that some sunscreen also have allergies, so how should someone should deal with a sunscreen acne allergy, and can somebody use customized sunscreen for acne and acne prone skin?
So see, with the sunscreens, what happens, it's as I discussed earlier, like depending on the season also and which climate you are staying in, what is your day-to-day routine. So sunscreen are available in Indian market. We are fortunate enough that we have so many ranges of sunscreen available. We have something sunscreen which is for tinted hair. Then there are sunscreens which are matte, something which is more creamier formulations. We have gel base, we have sprays, we have water base also. So we have a lot of things available for us, and that makes us confused also. Everyone gets confused. But the main thing is, whatever sunscreen you're purchasing, you have to make sure it's non-comedogenic is written over there. Now, something which is non-comedogenic will actually not clog your pores, and that is not going to lead to acne. Okay, so that's the basic thing you should look after. Second of all, you have to look after whether the SPF is 30 and above, and what would be the PA triple plus rating. It should be 3+ and above. Right now we are getting 4+ and 5+ as well in Indian market. So this thing is important, plus how much you are applying. Like a 2 to 3 finger length unit is a good amount, and it should be applied like that 20 minutes before you step out, and repeat every 3 hourly. Now, that being said, if someone is having some probably a sunscreen allergy, what you were saying earlier, and that is leading to acne, it could be because the sunscreen is probably having certain ingredients which is not suiting the skin. Okay, it can happen, and also it could lead to blockages of the pores. That is what is leading to the acneiform eruptions. So,
okay. These are all the factors someone should definitely see before applying a sunscreen, right, doctor?
Yes. So one can always do a patch test, see how they are feeling the formulation, and depending on that, they can decide later on. And if a dermatologist has recommended that sunscreen to you, then it would probably suit you for a longer time as well. But sunscreen allergy is a little bit uncommon, but it can happen to certain individuals.
Yes, so taking that sunscreen,
It depends on the basically, Sanya, the ingredient which is there into it. Now, that is something one cannot pinpoint because it's a mixture of certain chemical and physical sunscreen. Certain ingredients are there in combination, and then there comes the preservatives and the vehicle in which it is being used to spread it over the skin. It should spread over the skin. So it could be due to any of those items. So in that case, just do a patch test. If you're repeatedly getting the redness, stop it and switch to some other brand.
Right. So it depends basically on your skin type as well, that what you are applying. Doctor, there's a very like a question from our viewer, because we were talking about sunscreen, we have talked about different types of acne. There is a question that can stress or certain environmental factor exacerbate acne in adults?
Yes, definitely yes. So as I mentioned earlier, if you have stress, your sleeping pattern would be disturbed. Your hormonal profile actually changes at that time. Your eating habits also changes because certain individuals, sometimes us also, like if we get stressed, we do binge eating and other habits we inculcate. We'll eat more of pastas and cheese and pizzas. So all those dairy products as well, the sugar intake as well, the late sleeping, the incorrect sleeping time, and disturbed sleep, that will all lead to increase in the oil production. Now, if the oil production is happening more, that is definitely the first step of how the acne can go into extreme level. So stress definitely plays a role, and we need to, that is when the exercise and the yoga and the meditation comes into play. You need to de-stress yourself. You need to take out some time for yourself.
Right. And doctor, I've also seen sometimes that the stress of getting a pimple can also cause you a pimple. That, some important event is coming. So, mujhe pimple na ho jaye. And the next day we see that pimple is already there and we are like, we were stressing out because of that only, that pimple now, oh, my face should look good. And then the pimple has already occurred.
Normally, Sanya, I see it in brides. So definitely, we dermatologists basically put them prophylactically on certain medications so that they should not get pimples. So the prophylactically, why we give it? Because the as the days are coming nearer, you get more stress out whether things are happening properly or not, whether things are smoothly going on or not. This is missing or that is missing. Then the routine of your normal day-to-day routine is also changed. You're not sleeping well. You're fully engrossed in the other activities happening around you. Then there are so many trials of the makeups and everything going on your face. So everything, and then there would be sometimes females do take certain pills and all to delay the menstrual cycles and everything. All this can exacerbate acne as well. Now in that case, there's nothing. If you are visiting a doctor, they would probably put you on certain prophylactic so as to avoid that situation. And one thing is, don't take stress. Instead, go visit a dermatologist.
Yes. Don't take stress that the pimple or the acne will occur. Go visit a dermatologist and be stress free. That is what doctor said. The stress can cause acne, and you should definitely go and consult your dermatologist for your any special day which is coming. Doctor, there is a live viewer asking, are there any underlying medical conditions that could be contributing to my acne?
Yes. If individuals, they are on certain medications, as I mentioned earlier, like people who have seizures and other issues, if they are on anticonvulsants, people who have some inflammatory, maybe something for rheumatoid arthritis or some other inflammatory autoimmune problems, if they are put on steroids, then that can also lead to acne. Then in females, particularly the PCOD, the PCOS, the hirsutism, where the hairs are coming excessively over the facial area, and your irregular menstrual cycle is there. Or if people who are trying to conceive, they are put on certain hormonal supplements. All those things can lead to acne. They have a direct relation to it. And occupationally also, it depends. Like those who are working at probably a hot, humid environment, they have higher chances of having more of body acne and facial acne. The heat, the humidity actually does occlude your skin, and that is what leads to the acneiform eruptions. So your occupation, your other diseases, if you have some other problems in the body, that can lead to acne.
Right. So all the things happening around you can definitely affect your skin type, and as doctor said, take good diet, eat healthy. That is important for managing your acne.
On your own. I'm sorry to cut in. See, the thing is with the females, if you have menstrual irregularity, the doctor would help you out in, ruling out the problems, what is higher and what is low. And accordingly, it can be controlled and treated as well with the medications. So unless and until the hormonal issue is not controlled, your acne will never get controlled. That's a byproduct of the hormonal issue. So you need to correct the hormonal issue, then only your acne can get controlled.
Yes, and I think that can be corrected by consulting a dermatologist because they better know that what is wrong and what is right. Before self-medicating, you should consult your dermatologist and doctor. It was such a lovely session. We were talking about the acne management. Any closing before we end this session? Any closing remark for all our audience watching this live? Any takeaway message for all our audience watching this live?
Thank you everyone for patiently listening to this talk. Thank you, Sania, and your team for giving me this opportunity. My only request and the closing remark for this talk would be, if you have any doubts, anything, go to a specialist. Your dermatologist is your specialist. Don't look for people, don't look for short-term results or instant results. They are often misleading and misguiding. What your skin can suit, how much to apply, what creams to apply, what strength to apply, that is what a specialist can only guide you. So don't look for TikTok videos and Instagram videos of the influencers telling you to apply this as a nuska, ghar ka nuska and all. Sometimes all these acids and other thing actually can ruin your skin. So rather go to a dermatologist, whomever is nearer to you and you're comfortable with, and get it treated, or at least get your skincare routine properly planned out for you. Don't blindly follow the skin specialist, so-called right now, everyone is skin specialist in influencers market. So don't follow all those blindly. Go check the degrees and visit a specialist dermatologist only. That's my only request.
So go and influenced by your specialist dermatologist, as doctor said, that is important. Don't self-medicate. And thank you so much, Dr. Priyanka, for your valuable time. It has been a very informative session.
Thank you so much. Thank you.
Thank you. Thank you so much. And we really look forward for many such sessions in the coming time as well.
Thank you so much. Good day.
Thank you so much. Thank you for all the viewers for your participation for today's session. Good day, keep glowing and stay healthy.
Thank you.